Okay, so I am in the med room. We're going to be doing Marcheck 1 for the ibuprofen for Casey Banks. So we have Casey Banks, 10/2/1965, allergy to aspirin. We have an order for ibuprofen. I'm grabbing my ibuprofen per feeding tube. This is an oral tablet, which I am able to crush. BID, dose of 200 milligrams. The dose is 200 milligrams here at 0900. It has not been given today at that time. It is not expired, the package integrity is intact, and it does not contain aspirin. So I'm just going to check my sterile water that I have here that we will be using to reconstitute our medication after it's been crushed for the feeding tube. So I have my water here, package integrity is intact, and it expires December 2026. There's no particles floating around in it. So I'm going to pour into my med cup here. Going to add 20 mLs. So we're going to measure at eye level here, palming the label, and we're measuring 20 mLs. And I'm pouring the fluid first so that I have accurate intake measurement for our patient. So I'm setting that aside. Now I'm going to crush my pill. So if you have more than one pill, be sure to crush only one at a time. So we've done our Marcheck 1. Now I am opening this up. I'm saving the wrapper. We're going to put this in here. And we're going to crush this into a fine powder. Okay. I'm going to open up my cotton tip applicators, which are not intact and they were not expired. They were intact and not expired, sorry. So I'm taking the wooden end of this and I'm going to tap my powder ibuprofen into this med cup with the water in there. So we're just tapping that in. Getting out as much as we can. Okay, once we have all our powder out, we're just going to give this a swirl. And I'm not using the cotton end of the Q-tip because I don't want that to absorb any of the medication that I want to give to the patient. So we're just stirring this gently, mixing it all up. Okay. So now I'm going to begin my Marcheck number 2. So we have Casey Banks, 10/2/1965, allergy to aspirin. We had an order for ibuprofen, and I have ibuprofen here, which I crushed up and put into that med cup. So ibuprofen per feeding tube. We did crush it. BID, this was a tablet. Dose of 200 milligrams. This was 200 milligrams. And we crushed that and added it with 20 mLs of water at 0900. It has not been given today at 0900. I'm just going to check my package integrity of the rest of my equipment before I go into Casey's room. So I'm going to bring my water with me. We already checked that. I have some clean medication cups that I'll use for my flushes before and after the medicine administration. I have my alcohol wipes. Package integrity is intact and they are not expired. I have litmus paper. Package integrity is intact and it's not expired. I have my measuring tape. This is new, it's not dirty. I have a washcloth that I'll bring with me. I have a 60 ml catheter syringe. We would say that package integrity is intact and it's not expired. So of course we would have a new one. And then I have a slip tip syringe. Package integrity is intact and it is not expired. So now bar checks 1 and 2 are done and I've checked my package integrity. I'm going to then move into the patient's room.